I'm Leslie Elliott Boyce, and this is The Radical Center, a recording project I began in 2022 as a way to describe and discuss the social and ideological currents that are rapidly altering our culture. In a time when political polarization seems to be the norm, I'm seeking to understand rather than react. I'm grateful to all the thoughtful men and women who share their stories and insights with me in this conversation series. If you would like to contribute to this project financially, there are links in the description. Thank you, and thank you all for listening and being part of this exploration. Today I'm speaking with Robin Atkins, and Robin, you are a counselor who specializes in reproductive mental health, and that is so fascinating to me. In fact, I don't think I had ever heard that phrase, a counselor specializing in reproductive mental health, but that was really what got me interested in working in counseling in the first place, was working with women over the reproductive life cycle and around all the issues that arise for us from puberty through menopause and beyond, and childbearing and child loss and all of the many issues. And that was what really inspired me in the first place, or the population that I thought I would end up working with. But it's been quite a different path for me, but that was an early inspiration. So I'm really curious to know more about your practice and what got you interested in doing the work that you do, and the issues that you think are important to talk about.
So it's kind of interesting because my story is kind of flopped, where I didn't think I'd be working with this population. It had never crossed my mind. I always envisioned myself working with mental health and law. And just along the way in getting my hours for licensure, I worked with all different kinds of demographics. And then as I was having my own pregnancies and my own babies and my own losses, I started wanting my own therapy around those events, and it didn't exist in my area. In particular, I had a baby in the NICU for a month. And during that time, I had a 2-year-old at home and a baby in the NICU. So I was dividing my time, 12 hours home, 12 hours hospital. And I really wanted a therapist, and nobody went on site. And I didn't want to take time away from home or the hospital to go see someone. And so I just decided it needed to happen. And at that point, I didn't know that there were other people doing it in America. Maybe now there's about 50 of us, maybe. When I first started the specialty, there was about 20 of us. So that was about 10 years ago. There are 2 or 3 doctorate programs for psychiatry and reproductive mental health, but that's really centered around medications in postpartum more than it is the actual counseling piece of it and all the other issues that women might go through. So there's one textbook on reproductive mental health that was released in 2021, January 2021, that's used in colleges now. And I think some colleges are offering like a single course on reproductive mental health. But other than that, there's not much that exists. So I wrote curriculum. It's about 25 continuing education hours for reproductive mental health for practitioners that are already licensed. And that goes live in 2025 to hopefully help other practitioners that are already in the field, that are already seeing the things that I see, have a little more background on what already has been done as a specialty in this area, especially overseas. They're about 5 years ahead of us in all mental health things. So there's a lot of stuff a lot of information and a lot of wealth of knowledge we can glean from over there to bring over here.
So you've really had to sort of blaze a trail yourself based on need that you were experiencing yourself and perceiving in others.
Yeah. Yep. It's interesting too, when I opened let me back up a little bit. I wanted to bring perinatal hospice and palliative care specifically I live in Fort Wayne, Indiana, so to Fort Wayne. And we have 2 major hospital systems here. And there were pieces of it that exist, but not a whole program in Fort Wayne. There are 2 programs in the state of Indiana that exist, but nothing real close to where I live. And I banged my head against brick walls for several years trying to get that in the hospital systems here. And by the time I was done getting my licensure, where I could finally go out and private practice on my own, I still couldn't get the hospitals to buy in to it. So I just decided to open private practice. And I was really nervous that I'm never going to get enough patients. It's such a niche specialty. But within 6 months, I had a wait list, and I've had a wait list ever since for 10 years. So there's a large population of women and men experiencing infertility, loss, and all types of complications around reproduction. and like you said, puberty and menopause as well.
hmm hmm what are some of the main issues that you end up seeing, and was it what you expected when you started, or has it taken some unexpected shape?
That's a great question. It When I started, it was what I expected initially.
Hmm
It was really women experiencing loss initially. And when I started, I was actually 32 weeks pregnant when I first
Okay.
opened my private practice. And that was really interesting, having to let anybody know who was seeking therapy. Like, I could be a trigger in and of it. My body could be
Right.
a trigger for you if you're
Right.
experiencing loss, and I'm very, very pregnant. So that was quite an interesting, rapid uphill learning curve of how, in that space, I, as a woman bearing children and having young children, could impact my patients in a like transference, countertransference way. So that
hmm
was a little, I knew that that was a possibility, but how much it impacted it was surprising. It's been positive overall.
hmm
And then I wasn't expecting the large numbers of women and men wanting help with infertility.
hmm
My own infertility journey was very short. I was told by several doctors I would not be able to have children because I have endometriosis.
hmm
But my husband and I were able to get pregnant within a month of trying. So I really didn't, like, I had years of thinking I wouldn't, but I
hmm
didn't have any actual struggle trying to get pregnant. So I didn't really have that same infertility journey that other people do have. And so that was a huge learning curve for me. And my patients really taught me a lot about what that experience is like, and also like the vocabulary and vernacular around that entire world of IUI, IVF, all of those things. I knew next to nothing about
hmm
any of that. So my patients really helped me learn quite a bit about that. They were very gracious.
So you had your own experience with infertility being mostly psychological for you, this fear of not being able to conceive and what that meant for you and for your life.
Yeah. And I've been married twice. My first marriage, I wasn't planning on having kids at all with him, and he had a
Hmm
vasectomy, so that wasn't even an issue for us.
hmm
But my second marriage, yeah, going into that, dating him and explaining to him, like, there's likelihood I won't be able to have children. We both really did want children. And so we had always just assumed we would be doing some type of foster to adopt type of
hmm
situation. But we were in the age of the best time to reproduce. We were both on the upper end. He was over 30. I was 29 when I had my first. So we didn't wait very long after getting married, about a year, and
hmm
then start trying. So we didn't have a terribly long time to sit in that, like, are we going to be able to have children? But
hmm
yeah, and I think, I don't know, because I was told so young
hmm
that I wouldn't have kids. I was 16. I didn't know at that time what that would mean for me, and it didn't really have any major impact on me at that point. I was like, okay, I'll just do career.
hmm
That's
hmm
fine. It wasn't till I married my second husband and really wanted kids that I had any kind of emotional experience of, oh, I really wish that could happen for us
hmm
personally.
Much later.
Much, much
Hmm
later. And I do think that hearing that so young impacted how I interacted with my body, how I interacted with men, how I interacted with birth control, how I interacted with um, sex. All of that was
hmm
different based on hearing that so young.
hmm Yeah, I can imagine. I can imagine it was really formative for you, kind of going into adulthood thinking this is going to be my life trajectory. And how
Yeah,
many
and just
kids
not
do you
thinking.
have now?
Now I have four living
Okay.
children. I have two
Uh-huh.
that have passed and four living children.
hmm something that's always amazing to me is how every woman has a story just about. I mean, it seems like for everybody that you meet who has a really simple childbearing story, there are many others who have a story that goes beyond what you see on the outside.
Hmm.
I've got four children also, but that represents seven pregnancies and a
Hmm.
couple of them really traumatic losses.
Hmm.
So,
Yeah.
oh,
Yeah. There are so many of us walking around, we're the silently wounded, that you
mhm,
don't see those losses bared maybe on our face or in our body
mhm,
language. But it's interesting, doing this work. My children, especially my older two, are teens. They're very aware of what I do and what all goes into that. I've been doing the specialty almost their entire lives since they were
mhm,
very little.
mhm,
So when we meet someone new and they ask, how many kids do you have? That's such a common
mhm,
cultural question. Kids, job, where do you live? Are you
mhm,
married? My kids pipe up, oh, there's six of us, and people are counting, and they're like, oh, and then so it's pretty
Mm-hmm.
common that my kids will let the cat out of the bag, so to speak, about there's two that aren't with us. And that doesn't bother me, but it took a long time for me to be that comfortable to just like,
Mm-hmm.
how much information I'm going to give you. Am I going to give you the 2 minute version, the 2 second version, or the 2 hour? Let's sit down and have a conversation about loss.
Mm-hmm. Mm-hmm. And what's the significance for your family of talking about those losses? What role do they play in your family's self-concept, I suppose?
They're in our family every day,
Mm-hmm.
but not in any kind of fabricated, unnatural way. It's when it naturally would come up in conversation or when we're planning around special events or holidays, or October is Infant and Pregnancy Loss Awareness Month, which is
Mm-hmm.
big in my profession, and working with my clients, but also at home. There's a few things we do that month at home to honor the ones we've
Mm-hmm.
lost. So it's pretty common. Every once in a while, my kids will independently bring up um, their siblings that aren't here and talk about them. My younger two are 10 and 7, and my 7-year-old right now is very curious around all of that. So she talks about them quite a bit, but it's just natural questions kids have around death and
Mm-hmm.
family and what does that look like and how does that work and how does that, she's trying to figure out how it's different for her than her sister or her brothers or her dad or I. Like, she's really trying to figure out all those relational pieces of the ones that aren't here and how that works for everybody involved.
And that's really interesting. I found out my mom had a miscarriage when I don't know how old I was. I must have been late childhood, and had some conversation with my mom where it came out that she'd actually had a miscarriage before I was born. And it really was so profound for me. Like I felt I went through this whole grief thing. I mean, I thought about this older sibling I could have had, and I made up an imaginary story about this person. And I even had anger at my mother
Mm-hmm,
for
mm-hmm,
this loss, this thing that was missing in my life. And
mm-hmm,
um and yet when cultural conversations around pregnancy have become alarmingly callous
mm-hmm,
towards pregnancy, which is so interesting. I mean, I'd love to talk with you about abortion because I know you have a lot of views that you've expressed about it, and I have a lot of thoughts about it as well. I think it's such a big topic for especially women, especially right now as it's become really politically,
mm-hmm,
I guess, front and center charged.
mm-hmm,
And it's a lot of there are a lot of reasons that people have on both sort of sides if you want to position the argument as a polar argument. But something that seems like it's really lost on the pro-choice side, if you will, is the significance of the life of the baby. There's even if you are making a choice, even if you can make an argument that there are some times when that would be a choice that would make sense for a mother to make, there should I just feel like it's why wouldn't you talk about that with all of the significance and weight that that has? So
mm-hmm.
I'm curious. I don't mean to just dive right into that big
No,
topic,
I'm glad you
but
did.
yeah. What
Yeah,
are
I'm
your
very
thoughts? Yeah.
comfortable
Okay.
diving into that. So,
Okay.
yeah, and so I don't know if your audience has seen any of my other interviews before or any of my work. So, full disclosure, I had an abortion in my early 20s, but that story is a very long and complicated one. It could take us an entire probably podcast to go through the nitty gritty of that. But I will just say I didn't process it till 18 years later.
Mm,
So it's just been about 5 years, 6 years that I actually even have dealt with that. And even that loss didn't register that I'm not infertile. So it didn't,
interesting.
yeah, it because of how it all went down, it didn't even occur to me. But
Mm,
regardless, I think what's lost on both sides of the discussion is the humanity in it at all. From the pro-choice
mm,
side, I agree there's a loss of the value of what is lost in an abortion,
mm,
regardless of how a woman might feel about making that decision and whether she feels it was the right decision for her. She could 100% feel it was the right decision and
mm,
not regret it at all and still grieve and feel
mm,
lost about it. And I think that that is on the pro-choice side completely ignored. And on the pro-life side, it's villainized
mm,
as she's some terrible, evil person. When what I see is motherhood. I think abortion is a parenting decision
okay.
because to me, once you're pregnant, you have offspring.
Mhm.
And whether or not you label yourself a mother, I don't need someone to do that, but they have offspring. So to me, it is a parenting decision. And I think both sides kind of miss the relationship part of it, but that is so missed in pregnancy in general. Even in our healthcare industry, it's very much treated like a medical process,
Mhm.
not a relational process. And so we have three parts of it. It's biological, it's inherent, it's how our species reproduces. And so that's just in and of itself something we can't avoid. We're big in 2024 trying to avoid biology, but it's just not going to go well if we continue to try to do that overall. Um, but then you have the medical side. When does medicine need to step in to a natural biological process, and when does it need to hold back and just let that process unfold naturally? And we're not doing that very well.
Mhm.
And then we have the relational piece of there's another human being growing and developing, and then we have the very real physical connection between mom and that being, and then even dad or siblings. And that being, especially when I think about my last child, we had her at home,
Mhm.
and all of us were there. And so my children at that point, my oldest two were old enough to ask all the questions around all of that. So watching the development, going to appointments with us, seeing her born, seeing the aftermath and the postpartum of that, like it's an entire family relational event. There's a whole new human being
Mhm.
shaking up all the dynamics in the household in a positive way for us, but sometimes it can be very difficult too. And all of that is lost in these discussions of abortion. Even if there is an abortion, what's been lost can touch multiple people. So in my own abortion, I have siblings.
Mhm.
So they have niece or nephew that isn't here. I have parents, and my father's since passed, but my mom processing the loss of a grandchild. And my dad knew before he passed, but not very long before he passed. So I haven't experienced his processing of that. And then my children's processing of the loss of their sibling. And in that way, my youngest two have heard the word abortion, but they don't really know what that means.
Mhm.
My oldest two are very well versed in what it means and what it
Mhm.
actually happens during that. And so their own processing of all of that.
Mhm.
Um, so even that is when it's talked about openly and not hidden,
Mhm.
a familial relational journey.
Mhm.
And it's interesting because the pro-choice side talks about there should be no shame, but
Mhm.
they also don't want us to talk about it in a way that is the reality of the relationships of it. So I don't know how to not carry shame, but also not talk to my children or my spouse or my mom
Mhm.
about it. Like that feels shameful to me to not talk about it with
Mhm.
them. So I'm very confused around like we shouldn't have shame, but also we can't talk about the relational part. That just doesn't make sense to me. I can't.
Mhm. Mhm.
That's a dissonance I can't live in,
Mhm.
if that makes sense.
It's like it just has to be suppressed.
Hmm.
Mhm.
Yeah. Hmm. Yeah.
Yeah,
And
it's go ahead. Go ahead.
it's taboo,
Mhm.
but also we're supposed to shout about it and celebrate it, but it's taboo to talk about it. It's very strange. And on the pro-life side, um, I think people don't maybe understand the complexities of what it looks like for a woman to walk into that clinic or that space,
Mhm.
and the very real feelings of crisis, whether or not there's actually danger present, the very
Mhm.
real feeling that there's danger and crisis present if she doesn't address this immediately,
Mhm.
and how both sides tend to infantilize women in ways that are unhelpful, but also hold women accountable in ways that are a bigger societal issue. And so that all hasn't been teased apart correctly either, and how we handle it politically, in my opinion.
That's really that, yeah, you're pointing out a lot of different contradictions in the rhetoric around abortion.
Mhm.
And I I guess I can understand, and I have abortion stories that I know of and that I've been close to, and I think that it's a really complicated decision that I don't have a hard and fast yes or no on, and I wouldn't want to make that call for someone else. But there are so many elements of this that I think, like you're saying, are just not being addressed in a helpful way, in a nuanced and careful way that pays the topic proper respect because it's such a big decision in a person's life. And if you can conceive of a a pro-choice argument that says that there are some cases where this is, as you put it, a parenting choice, a life choice, a planning choice. Like there are a lot of women, for instance, who have children with someone that they later divorce or have a terrible relationship with, even a horribly abusive relationship. And they look back and try to make sense of all of it, and they can't really regret that relationship because they have their children. And similarly, there are women who've had abortions, but later on went on to have a marriage and family that they're so grateful for. And if they try to reconcile that story of their life, if they had had the child with the partner that they were with when they had that initial pregnancy, maybe their story would have unfolded so that these children that they love so much wouldn't exist in the world. So it's hard to go back and regret. It's just such a complicated story in someone's life. But I think that there are elements of what happens in our abortion care industry, whatever that is, that are really shocking, like some of these late term abortions that are more common than I realized. I didn't realize this was as prevalent. I thought this would be like an emergency sort of situation where there's a gross birth defect that's about, that's going to kill the baby really imminently, cause a lot of suffering. And so this is sort of a palliative option. Or maybe some extreme life of the mother situation, but actually it happens more often than I thought. And also there's the selling of fetal tissue, which just seems really barbaric. And it's kind of shocking that we have human beings that are dismembered and sold.
Mm-hmm.
And so I know that's kind of a really, I didn't give any kind of trigger warnings for this topic, but hopefully people who are going into a conversation about reproductive care can kind of take it as it goes, because it is such a big and grisly and often emotional subject to wade into.
Mm-hmm. Yeah, I think the way it's talked about and the way abortion is done and actually what it is takes a lot from women.
Mm.
And so without any claims about law at all, I'm not talking about policy, politics, nothing, but just abortion itself and how it relates to women.
Yeah.
It inherently undoes our biology. So pregnancy is a healthy state for women. There can be complications during pregnancy, and I don't want to minimize that. They can be very serious. But even the way we talk about that, so like preeclampsia can be extremely dangerous. That doesn't mean pregnancy is extremely dangerous. That means preeclampsia is extremely dangerous. But the way we fearmonger around pregnancy, and pregnancy being a state of biology for women, we're fearmongering about women's biology and women's bodies. So that takes away from women, that alone, just that conversation alone. Pregnancy is so dangerous. Well, then our bodies are ticking time bombs. Like it's very unhealthy for women. And then you add in our biology is undone. And that has consequences, whether they're minor or large, it's woman dependent. But there are consequences to undoing healthy biology. And just thinking about breast tissue and how far along were you in pregnancy and how much had that changed. There's consequences there. There's consequences with once you're pregnant with a child, their cells interact with your cells. And with microchimerism, you carry their cells with you forever. And then there's consequences there. And so there's just, we undo all of that. And we don't even discuss that about how that might impact women. And then when we talk about cases like domestic violence, for example, I'll hear, well, abortion saved me, but abortion didn't actually do anything other than remove the child. The woman still had to do all the effort to get out of the relationship. Now, it's also true that not having another child might have made it easier legally and logistically to leave that space and get out of that, because our current court system doesn't handle domestic violence well at all. And so there's the reality there of like having another child might have made it more difficult logistically and legally to leave. But the abortion didn't create the leaving in and of itself. The woman still had to do all that work. So even claiming abortion got her out of it is taking away from her all the very difficult work and emotional and mental turmoil she had to go through to get out. It takes away from the story of how legally that impacted her and we don't even get to discuss the court system and how it makes it so much more difficult for women to get out of those situations.
Yeah.
So all of that is lost. Like it's used as such a Band-Aid for a lot of things that even if it's going to be legal or not. If it's going to be legal, fine, but we still need to have these discussions about what are women still going through rather than just saying, well, they can have abortion and it'll be fine. It's not going to be fine. It
Mm-hmm.
doesn't solve all of that. It doesn't stop rape. It doesn't stop genetic anomalies from happening. It doesn't cure preeclampsia. It doesn't fix any of those problems. It removes the immediate feeling of crisis
Mm-hmm.
around those, but it doesn't fix the ongoing problem that was there before the pregnancy.
Mm-hmm.
So all of that is lost for women, all those very valuable conversations we need to be having. And then even in research and healthcare and even in reproductive healthcare, a lot of what I think women deserve in those moments is lost because of how much we degrade our bodies in the process of pregnancy as a bad, dangerous, difficult, terrible thing.
Mm-hmm. I think that I know people have, I've had a couple conversations about abortion before that have been recorded. And so if people have already heard this story, I apologize. But when I was in law school, one of the cases that we talked about was a California case. And I've talked about this, I think, 3 times. So I should have looked up the case so that I could say what exactly it was and reference it, but I don't remember. I remember some of the facts of the case. It was a murder of a woman by her husband, and she was pregnant. And so the decision that was important for our study in that I think it was a criminal law case, for a criminal law class. Sorry, um, the decision that we were studying was on whether to consider it a double homicide or just a homicide. But the the arguments, I can remember some of the arguments that were really eye-opening for me, and it kind of highlights what a blunt instrument the law is. The argument against calling it a double homicide included some reasoning about how if the state takes a protective relationship, takes on a protective relationship with the unborn, how this can end up limiting the rights of the mother in some really significant ways. Because as soon as we see that unborn child as a state protected entity, we have, by that logic, we can restrict mother's behavior legally during pregnancy beyond just termination. So we have to define what is the protective relationship that the state has. But I think that the justice or the author of the opinion wrote about even maybe locking women up to keep them from smoking, or preventing, legally punishing and fining women for doing things that are not standard of care based on what their medical providers have told them. So this could include legally forcing women to, for instance, take vaccines if the doctors have decided that that's standard of care for pregnancy. So you can be forced to provide medical care that impacts the unborn based on whatever the regime has decided is appropriate during your pregnancy. So this is really alarming. And what it highlighted for me was how, again, like I said, what a blunt instrument the law is. And so I've tended to conceptualize this issue as a spiritual issue rather than a legal issue. And I could see room for I would love to see some sort of a Human Dignity Act that prohibits the sale of, or the profiting off of, fetal parts, for instance. That for sure. I can't imagine how we've allowed that to be a thing that's being done. But to actually have the law say that a woman can't access that care, it seems like it's an issue between her God, her provider, and her family. But because of the difficulty with bringing the state into that relationship. But I know that's kind of a sloppy and inarticulate way to voice that, but I wonder what your thoughts are about this and how you
Yeah.
conceive of the issue.
So no matter which way you look at it, that perspective of should the state intervene and prohibit women from acting, and what are the potential outcomes of that, like putting her in prison for smoking during pregnancy, that's sloppy and not pretty. But the other direction is sloppy and not pretty either. It's the outcome of, so a woman is murdered while pregnant. It was a very much wanted child by her and her husband, and he can't get justice for his child that's dead anymore.
Well, he was the murderer in that case.
In that
Yeah.
case,
But
yes.
yeah.
But
Yeah.
but
Yeah.
or the other siblings, or whoever else has a relationship with that child can't get justice for that child. Or a woman wants, say her baby's diagnosed with spina bifida and wants surgery in utero for her child. There's no legal protection for her to force that to be offered for her either. So if we dehumanize the unborn in order to protect the mom's right to make decisions about her own body, we're preventing protections should she want protections for her unborn. So there is no clean way legally to do this where no one has some type of prohibition from what they might want in the end. So when I try to explain my legal thoughts about all of it, I have my ideology and then I have reality, and they're two separate things. And my ideology, and I have a philosophy degree, I can't get around the fact that the very basic concept that all humans are people. There's not a single human being that isn't a person. In my philosophical view, I don't, once you start, well, if they're not developed this much, well, then that's ableism and ageism, and where do we draw the line there? Or if they exist inside the woman but not outside, well, now we're talking about location and logistics. So are there other, there's no clean way for me to say, this type of human being isn't a person. So from an ideological perspective, I don't know how to reconcile that. But from a reality perspective, we get into all these messes now of okay, if we acknowledge legally the unborn as persons, then they have legal protections as persons. And so what does that do to women? I would encourage everyone to consider, what are the legal protections we give to children that are born now around their parents? We don't put parents in prison for smoking around their children if their children are born. So would that become different if they're pregnant? I actually think the dangers of smoking, in particular pregnant, are less than if the baby's born, as how much the child gets. But that's one specific case, and it doesn't handle the overall issue of what. So we're already making those decisions just for born children about what we do or don't do to parents and how they parent their children. So they're going to be messy decisions regardless. And so I think we still have to have the conversations, and there isn't going to be a clean all this or all that. I think when I look at the mechanics of abortion, one of the things that's really bothering me currently in our present state is the fear mongering around a lack of abortion increases women's likelihood of dying during pregnancy. When I don't know if you have heard of the principle of double effect.
I don't think so.
Okay. It's a philosophical term when any medical professional or physician is in a position of they have two humans to care for. And that could be triage. You have a car accident, two people come in at the same time. It's kind of the same type of triage when a woman who's pregnant comes in. The goal is to save both always. And if in the goal of saving both, one dies but isn't intentionally killed, that's the principle of double effect. There's two effects of whatever action was done, but no intention of harm was had. So if a woman has preeclampsia or HELP syndrome at 19 weeks and has to be delivered in that moment, there's no way other than delivery to save her life, that would be a principle of double effect situation where she's delivered either induction or C-section, but no intentional harm is caused to the baby. Palliative care and hospice care is given until the baby inevitably passes. So I think in our current conversations around that, because of how politicized abortion has become, we fear-mongered, and now women are terrified of going and seeking out healthcare should they be having a complication, even a complication during miscarriage. I know that doctors do these every single day, these procedures every single day across the country. They aren't prosecuted. There's no single law that's prosecuting them for doing a D&C because a miscarriage is incomplete anywhere in the country. But because we politicize this and make it mother versus child instead of mother and child, women are terrified. And to me, that's the biggest current miscarriage of justice against both woman and child, is the pitting of the two against each other, rather than why aren't we doing our best for both?
Because of those extreme scenarios. I'm glad you brought up philosophy, because it does seem like this is a really philosophical issue. And one of the things that's so difficult is that I don't think we even really know how to conceptualize of a woman and child. What are we talking about? Because when you're pregnant, you're not really one person.
Mhm.
You're not two separate people either. What are you during pregnancy? And when I worked in primary care for years and for over a decade, and for a while I worked at this clinic that had a lactation center adjacent to the clinic. And in lactation billing, they bill the mother and child as a dyad.
Mhm.
And so we've kind of created these ways to think about mother and baby. They're not separate. They're not completely one either. So how philosophically do you navigate that space?
Well, to me, it is philosophically a dyad. It's
Mm-hmm.
the only relationship in human history where two human beings exist in the same exact space at the same time.
Mm-hmm.
So I don't feel some kind of need to be able to put that in some kind of vernacular that meets all other human relationships. It's the only kind of its kind.
Mm-hmm.
So to me, they are two unique human beings coexisting in the same space. And there is a dependent relationship going on. It's not parasitic in any kind of way, but it is dependent. And it's, to me, it's a dance. That's the best way I can describe it. It's a dance. The immune systems are working together in support of both. If mom gets injured, baby can send healing cells to mom to help repair her, and vice versa. It's a beautiful dance
Mm-hmm.
that is the most interdependent and critical relationship in all of humanity, in my opinion, not just for her and her baby in that moment, but for all of humanity and our species continuing. It is the most critical relationship we have. And we see that even after birth, children taking from their mother and the extreme trauma and wounds that causes for both, we can't replace that relationship during pregnancy. And it gets into all kinds of sticky things like surrogacy and all of that. What does that do to all the people involved? Like, we could talk for hours about, by not recognizing the importance of that singular relationship, how much trauma we cause human beings. And you were talking about a minute ago, like how hard it is to even define mother and child, but we're like struggling to define woman in our current culture.
Yeah.
And so it's even one more step removed. But to me, from a philosophical lens, it was always the way we were headed. Once abortion became a normalized, no big deal type of thing, we were already always headed to this. Now any part of women's reproduction can be commodified and no big deal. And then buying women's body parts is no big deal. And transhumanism is no big deal. It was always, to me, headed that direction from 1920s on. And that's not me trying to say that the abortion industry always was headed that direction. It doesn't surprise me now that the same people providing gender care are doing abortions. To me, it's all the same bag if we are deconstructing biology.
When you mentioned really briefly in passing the phrase microchimerism, I was just trying to explain this to someone the other day. Would you mind explaining a little bit about the chimeric quality of the mother after she's been pregnant?
Sure. So it's the reason why we can test a mother's blood at 8 weeks of pregnancy and determine the biological sex of her child. Some of these cells of that baby are transferred back through the blood in the umbilical cord to mom. And so those cells exist within mom, as far as we know, forever. It's also the same for sexual partners for women, by the way. So any man a woman's had sex with, his cells are then transferred into her, and potentially she carries those for the rest of her life. And
Not
so,
just the man she's conceived with, but the man
right,
she's actually had sex with. Wow.
right. Yeah. That's a whole we don't have to talk about that. That could be a whole other podcast in itself. But so for me, it's a very healing thing to know that the two children I've lost still exist in a very physical way within me. Their cells are still somewhere floating around in my body. I don't know how much they impact us, and we don't know a whole lot about how much ongoing they impact. We know during pregnancy they can be healing, but we don't know after pregnancy how much work they can actually do. But yeah, they still exist, and I think it's a very beautiful physical encapsulation of how important that relationship is, that the two are forever physically entwined.
How How much does it change a mother to be pregnant?
Oh my gosh, her entire frontal lobe changes.
Mm.
Um, and we don't have a lot of research around how early a pregnancy might end, how much change does or doesn't occur. And I'm not even discussing abortion necessarily. It could be miscarriage, any pregnancy
Mhm.
ending. We don't really have research around how early, how much does that interrupt the change.
Mhm.
But I see it often talked about in a very basic way of like women give up their identity when they become pregnant. And I don't think that's actually true. I think we retain our identity. I didn't stop being Robin. I just became more than what I was before. And my brain shifted in a way of my perspective was no longer for myself and partner or self. It was now I am responsible for the nurturing, caregiving, protecting, upbringing of another very dependent human being. So my entire focus shifted over 9 months to that was my primary focus.
Mhm.
It's very primal and not something we can necessarily manufacture. And some women do struggle with that. In my pregnancy, where I had my preemie, I didn't really feel bonded to him in the same way for 2 years after his birth as I did the others. I would have slayed dragons for him. I had that primal, I will protect you, but I didn't have that warm, fuzzy
Mm.
baby moon kind of just want to sit and stare at you all the time. It was much more of a life or death situation. So it was much, my senses were much more on a survival level, and I wasn't able to like rest in that beautiful aura
Mhm.
of motherhood.
Mhm.
So it can be different depending on, I suppose, what circumstances are around. But yeah, mother's entire frontal lobe, our connections and our attachment shift, and babies' attachment and bonding occurs from somewhere in the second trimester through 2 years of life. And so how their relationships for their future will be are set up during that time frame. And so even that is something we don't even really discuss. And the research I've seen around that has mostly been about children born via C-section versus vaginal birth, and just how much that impacts a child's attachment frontal lobe development, just that alone. And so, for example, preemies have a 99% higher risk of having ADD and a 24% higher risk of being on the autism spectrum.
Mm.
And it's all frontal lobe attachment based things. It's biological, it's chemical, it's not relational necessarily, other than those
Mm.
structures and attachments happen because of the relationship during pregnancy.
That's really fascinating. I feel like that's a topic that could be explored at length. I would love to understand more about that. And there's that kind of it links a little bit to something else that I was thinking about when you were talking about women accessing care in emergencies. And I was thinking about how much more medicalized pregnancy has become. I had I had three hospital births. My first two were hospital births, and they were really, uh, I don't want to abuse the word traumatic because it's thrown around so much, but the way that I was treated as a young woman, I was 19 and 21 in the hospital having my children was was really inexcusably horrific by care providers. My third child was born at home, and then my fourth one, because we lived on an island without a hospital, I made the very difficult choice between home birth and hospital birth so that I could just be close to services if I needed them. And so I chose to have him in a hospital. And at that point, I was 37, and I had a lot of experience with this. I had a lot more confidence, and I was able to push back at interventions that were being very strongly pushed on me. And so it was actually a pretty good experience, but I could imagine if I were not more, if I had been like I was with my first two, young and impressionable and easily pushed around, it could have gone in a really negative way. And then my daughter she's 26 and she has her first baby. He was born in March. So I have a grandbaby now, and he was born at 34 weeks. And watching the cascade of intervention, she had a natural childbirth, but right after that, the way that he was whisked off and all these very precautionary interventions were forced on her child and her and she was kept at the hospital. He was there for about a month after he was born. And even though there didn't seem to be any need for that. And I was checking with the doctors and the nurses, and it really felt like this was just a protocol that was being imposed. And so there's this concept of birth trauma. And I wonder how much you encounter that as
So,
in your work with people.
yeah, one of the first questions you asked was, what do I see most often? And actually, birth
Mhm.
trauma is what I see most often.
Okay.
And one thing I'll mention just in passing is we don't actually know how much the birth experience impacts postpartum depression. I haven't seen
Mhm.
a single study on it, but I see it in
Mhm.
my practice all the time.
Mhm.
So that I want to set that aside for now. But birth trauma is something I see most often. And what I see being the underlying factor in all of it, because they're all different scenarios. They're birth trauma from vaginal births, from C-sections, from hospital births, from home births. What I see the underlying factor for all women is a lack of sense of control
Mhm.
during the process is what causes the actual trauma. It could be a terrible loss, and she might have to grieve the terrible loss. But if she felt in control of the decision making during, it wouldn't have like PTSD type trauma attached to it.
Mhm. Mhm.
So it's really this, like you said, interventions being pushed on you. And even in my own experiences, I was 37
Mhm.
when I had my youngest son, and I was 39 when I had my last. When I had him, it was an unnecessary C-section. I was already doing my specialty as a practice. I was already as educated as a woman could be on interventions and medical care and reproduction and all of that. I had been through 4 pregnancies at that point, and 2 births, one vaginal, one C-section. And even with all of that going for me, walking into that room, the doctor just, all he had to say to me was, your baby's trying to tell us something and he could die. That made me just collapse and go, fine, cut me open. In the end, it didn't need to be a C-section. There was no emergency, but that was an extremely traumatic experience for me versus the C-section I had before him with my oldest son. That was an emergency C-section at 32 weeks, but I had fully informed consent. I had made the decision. I went into it wanting it. Um, and there was zero trauma from the C-section itself.
Mhm.
Um, so I really think it does go back to that sense of control. And I agree with you that we've medicalized it. And I kind of joke sometimes that doctors, they love me and hate me. They have a very love-hate relationship with me. I'm on a board for a national organization of OBGYNs, and they, I think, love and hate me overall. They love me as a human being. But because I am such a thorn in their side about informed consent, informed consent, informed consent, because I do see so many women coming to me telling me these terrible things that they've experienced at the hands of doctors and medical systems.
Mhm.
But when I talk with the doctors and I do therapy with the doctors from their end, they've seen the worst possible scenarios unfold, women dying, their babies dying.
Mhm.
And
Mhm.
I think they have a very natural instinct of, I want to prevent that as much as possible. And then when you combine that with the medical system doesn't teach doctors how to sit on their hands and wait, it teaches them how to cut.
Mhm.
And so doctors feel more comfortable when they're in control, just like women feel more uncomfortable when they're in control. So if the doctor's trying to make the medical decisions and they feel more comfortable cutting, that's what they're going to present
Mhm.
as the option to women. So it's very much everybody in that room is experiencing something on a very personal level.
Mhm.
And when you try to take the personal, the relational out of it, just like anything else, it becomes this sloppy mess of somebody's rights are being trampled.
Mhm. Something I've wondered about, and I don't know if there's any studies on this, but is medical sadism, because we
Mhm.
do see, there are cases where it's like you're describing, this is a really difficult, it's a tense situation. Something has to happen. People are concerned. And so people go to their strengths or they go to their fears. But there's also there are so many stories of doctors being unnecessarily cruel. And I could just tell just really briefly 2 of those stories just from my own life. I had a second trimester miscarriage between my 2 sons. So I lost a baby, and I chose to go home and miscarry naturally after finding out that the baby was dead. And when I started to miscarry, I started to hemorrhage, and I was in a situation where I needed to go and have emergency treatment because I was losing so much blood. And while I was waiting for treatment in the hospital, and I asked after about an hour, can you give me any updates on when I'm going to be seen? The doctor said to me, you need to be patient. You haven't been here that long. The doctor's busy delivering somebody else's baby. But he did this in a way that was, I'm saying it dispassionately just to describe it, but this was delivered with cruelty and with, it was almost like he was taking out something on me. And I've seen this so many times. I worked in in the medical field for over a decade, and I watched as people seem to take an opportunity to hurt someone because of that person's urgency over and over, whether it's just medical administrative staff or actual care providers. Another one for me was I had an emergency oophorectomy. I had an ovary that twisted and became tangled in the fallopian tube. This was just about 2 years ago. And I had to go in. Ovarian torsion is so painful. And I've delivered 3 babies naturally. And this was as painful, if not more painful than my labors were. And so during this time, the doctor wanted to go in and take both of my ovaries out. And the surgeon came in and announced he's going to be going in and removing both ovaries. And I said, well, can't you just take the one? Why do you want to take the other one? And he accused me of questioning his medical decisions and then asked me, why do you want to keep it? And I sat there like, well, can you tell me what's the logic? I just want to understand what's the medical logic behind trying to take both. But at that point, he shut down and he walked out, and then he refused to treat me for several hours and left me in pain because he was so upset that I had questioned his medical judgment. And he still never gave me, and I did report this to the insurance commissioner, to the hospital. They did there was an investigation because this was such an egregious thing that the doctor did. But these opportunities that doctors sometimes take to be cruel, or nurses take to be cruel to women who are in this position, you must hear about this all the time.
Yeah, I do. And I've had my own experiences of cruelty. And to ask me, like, why does that happen? That would be me completely speculating on the psychology behind these doctors. And I think my only answer that makes any kind of philosophical sense in my head is just how much we in our culture disparage women's reproductive biology. Like, that is inherent in our culture. So I think in some cases maybe those doctors despise even that, and an inconvenience of women's reproductive events on their lives, and I have seen that in cases, for example, of like doctors wanting to schedule C-sections around their personal lives or vacations or whatever, rather than, not that they shouldn't go. They absolutely have a right to their personal life and go on your vacation. A woman can get care from someone else, but wanting to really push, like, I need one that has to do it. We need to schedule it. And so completely unnecessarily cutting women open. That to me is extremely cruel. And I don't know how other women experience it, but C-section to me, one of mine I had to walk back to, and it felt like I was walking back to my execution. It was the wildest thing to me.
Terrifying.
And in one of mine, they had both my arms strapped down. And I felt like Jesus Christ with my arms strapped down, and they're cutting me open, awake. Like, it's a very Twilight Zone thing to be cut open while you're awake and your baby being removed from you. And even in my case, days after, I was in a CVS getting medication for post-surgery. And I grabbed my stomach and started screaming, "Where's my baby?" in the middle of CVS, because I had birthed him. And he was in the NICU, and my brain in that moment just had this like delusion, psychotic, like, I'm missing my child. And thank God my husband was with me, kind of explained to the people around us. He was like terrified. But in those moments of cruelty, I really think it's a despisement of women's reproductive biology, the inconvenience of that on society in general, the inconvenience on their day of whatever they had planned. That doctor expected a super easy day of surgery that was planned, and this is a complication doesn't want, a longer shift he doesn't want, and whatever. Who knows? And it could also be, the only other thing that makes sense to me would be some kind of deep-seated ongoing issues with their mother being taken out on other mothers in this case.
Interesting.
But that's, again, just speculation on my part. I don't have any hard and fast. There's no research on it. I don't have any hard and fast thing that say this is why. That's just speculation.
I'd love to know if anybody's done any work on medical sadism because I think
Mm.
it comes up over and over again. And I
The
think that,
only,
yeah, it's like this desire to mechanize human
mm,
life and
mm,
to make it this technical, predictable thing. And
mm,
we're never more chaotic than when we're in a medical crisis. There's
right,
never more messy life stuff happening than then.
right,
I'm
right.
sorry, I
Yeah,
cut you off.
that's okay. I've had one woman in particular reach out to me privately about the sadism she's experienced at the hands of female
Mm,
OBGYNs.
interesting.
Um, and the way she describes it is feeling like they want to rip something from her.
Mm.
Whether it be during she's had an abortion, during
Mhm.
that, or during a live birth, very much feeling that these women wanted to literally rip her apart, rip something away from her or out of her. She said it felt very much like they despised their own biology and they were
Interesting.
taking that out on her. But yeah, I'm still exploring that with her. She's not a patient; she's just a friend. But
Mhm.
she's a friend. But exploring that, and that was the first time I had ever even considered like female sadism. But to me, it rings similar to these stories we hear of like Munchausen by proxy mothers,
Mhm.
this smothering mother type of thing. The way she describes it is very much female doctor wanting control, wanting domination, wanting to take and make decisions for and rip away from it. Just, yeah, it all that similar feeling of dominating mother. And
Hmm.
yeah, I don't know. I
Yeah.
think more work needs to be done around it. And I don't know how much screening is done in medical schools for practitioners. Like in my grad program for psychology, there was screening done around like, are you a mentally healthy person or not before you get launched into the field. I don't think it was super robust. And I have my own thoughts around like regulation versus freedom to practice and blah, blah. And
Mhm.
that's all sticky and messy too. But I don't know anything around medicine, if there's any screening around.
Mhm.
And we do know there's been cases of serial killers in the medical profession, nurses and
Right.
doctors both killing patients.
Right.
So yeah, and I do think there takes a little bit. I joke with my OBGYN friends, it's not normal to want to cut open a live human being.
Mhm.
It's just not a normal thought process. So whatever happens
You have to
during
cut
medical
something
school,
off in you to be able to do that.
yeah,
Yeah.
yeah, and whatever happens during medical school to train you,
Yeah.
be able to cut that off. And sometimes when they're being really honest, they'll say like the human in front of them becomes very much mechanical. It's body parts. And
Mhm.
I know how to do the script on how I work on those body parts, but I have to remove all the humanity out of it.
That reminds me, a friend of mine is a primary care doctor, and when she was in training, she was pre-med and thinking of going through a traditional medical school. That had been her plan all along. And she realized through friends who were already studying how dehumanizing the training was towards patients, how there was this real disconnection from the care for the individual in front of you. And she chose to study naturopathic medicine instead because it was much more collaborative and respectful towards patients. And so that's what she ended up going into. But maybe I should have another talk with her and see what her thoughts are about that.
Well, if you don't mind, I'll share a very short story.
Yeah, please.
I have one former patient who's asked me to share their story as much as I possibly can. They want
Mhm.
the world to know, but also I have permission to mention the doctor who was involved, who is a friend of mine, but I think people should interview her
Okay.
because she's an OBGYN. Her name is Dr. Christina Francis. And so she's had all that same training to have to shut off the things to be able to do the surgeries. But the whole reason she got into it, and still her heart, every conversation we have about it, is saving women and babies. Um, she's in her 40s, doesn't have children of her own, very much wishes that would have happened for her. And so this is kind of her, like, I think it's her mission and her passion to help other women and children do well. And so in this particular case, I had a patient who had twins, and something happened with the placenta around 20 weeks. It basically shredded,
Mm.
and they needed an emergency C-section at 20 weeks, maybe 21 weeks. But I mean, babies typically don't live that early. So this patient presented to the ER, and Dr. Christina Francis was the hospitalist on staff at the time. She wasn't the OB/GYN that the patient typically saw. Most hospitals have hospitalists that do emergency deliveries.
Mhm.
And so she happened to be the one on call, but she did her due diligence even in the midst of that chaos and that urgency and that fear and that very difficult relational experience that was happening with these people, to do informed consent, not just around what do you want to happen to your body, but what do you want to happen to your babies, and asked some questions around spirituality and faith. And so discovered that the patient was Christian and very much wanted whatever could be done for their babies as possible. So not to get too graphic for your patients, but the babies had to be held in while they were rushing to C-section in any effort to try to change them. So while Dr. Francis is, she's praying with the patient on the way back and not making any unfulfillable promises of anything, but just the only promise made, I'll take the best care I can of you and your babies. Even though both babies ended up passing, when that patient came to see me, zero trauma around the actual delivery of it, because she felt like Dr. Francis saw her children and cared so deeply about the actual experience of what was happening, not just saving them, but how she would experience in that and how her babies would experience that and her spouse would experience that. Just one example of a doctor who can blend both together while having to do really difficult things in the middle of chaos.
That's a really beautiful story. I mean, it's tragic what happened, but in that story, even though the outcome was absolutely tragic, during that process, the patient felt that her dignity was respected and the dignity of her children was respected.
Exactly. And no decisions were made without her consent.
I have a good story about a doctor too. So because we had bad stories about doctors, I'll give a good one too. After my second son, my fourth child was born in 2013, I went home and things were going fine. And then 11 days after he was born, I began to hemorrhage, and I had some retained placental tissue that started to cause a real problem. I was bleeding really heavily. I again had to be rushed in for an emergency procedure, and I had to be in the hospital overnight. It was a bigger procedure. They had to like scrape out the uterus and, sorry, everybody, that's too much. But
I mean, that's a big topic right now. The D&C is a big topic right now. So I'm glad you're
what that is. Yeah.
Yeah.
So it was, and I had a baby now and I was breastfeeding him. And so the procedure, the surgery and the recovery time, I was out and I was unable to breastfeed. And my doctor was so lovely. She was the woman who had taken care of my final part of my pregnancy with me, because up until the end, I thought I was going to deliver at home. And then I just made a decision. No, I felt more comfortable being in a hospital because our island didn't have services. And she gave us, she offered us breast milk. She was a new mother too. She had her own pumped breast milk. And she was so kind. She actually offered my husband her own milk to help our baby through that little period of time, because it was an emergency. I hadn't had anything pumped. And so it was so sweet and it was so human of her. And the care was wonderful. So I guess I wanted to pay a complimentary story and talk about that. You shared a really nice one. We did talk about sadism. It's not all that. There are some really lovely people in this field as well.
Well, thank you for sharing that story. And it naturally opens the door to, like, how do we care for women in postpartum who are having like postpartum psychosis, postpartum depression? And currently in the US, I can only think of 2 programs that allow women to be hospitalized with their newborns. So all the other women being separated.
Oh my gosh.
In the middle of trying to establish breastfeeding. Like there's just so many things about reproduction and the care of women and the care of babies that isn't being addressed. We're light years behind where I think we should be.
This was the most concerning part for me about my daughter being separated from her child when he was in the NICU as well. Was he was a really healthy baby with good vitals and everything was looking really good. But because of their precautionary treatments of him, they kept him separated from his mother during a point when it would have really been important for them to be together to establish breastfeeding. And so in order to take medical precautions, they devalued this other aspect of his development, her development, and their lives. And so my daughter was able to be there as much as she could. She really pushed and did. And she has been successful in nursing and establishing breastfeeding, but there was a lot of difficulty to overcome to do that. So that point that you're making about these women being separated is really well taken.
Mm-hmm. Yeah, I appreciate that. And I'm grateful she had you to help her be concerned about that. Because as a new mother of my first, I don't know about you, I was 29 with my first, but I knew next to nothing about establishing breastfeeding and what went into that and how important it is and how difficult for some women it can be. And I'm glad she had you there to champion that for her as well.
Well, I was so frustrated. She had to finally tell me to back off because I was I
Yeah.
was really upset about what was happening. So
Mhm.
yeah, but she
Yeah.
did a great job. Yeah.
Oh, good. Good. Yeah. I think as much progress as first world countries have made in managing the worst possible cases to have better outcomes, like when medical care is needed and we step in and do the right thing and do save lives, we've lost what third world countries still do very well, which is the whole healthcare around the entire person, all their parts of health, the wellness wheel kind of healthcare, and then village and community care around families. And I don't know if there's a solution to that for America because now we're all so separated, even like from our own families of origin. We move for jobs and whatnot. But the way that they do postpartum, there's a reason why rates of postpartum depression and psychosis are next to nothing in third world countries, and it is because of medicine.
There are two other things that I wanted to talk with you about, and and see what your thoughts are on them. And they are hormonal birth control and surrogacy. And I don't know if you have time to just dip a toe into those topics, and we could always do a follow-up if you're up for it.
Sure. So again, I have my ideology and my reality.
Yeah.
Ideologically, I think birth control's the devil.
Okay.
Hormonal birth control's the devel, ideologically. I don't think that means that I think there should be any laws passed around like you can't access it, that kind of thing. I'm not coming at it from a religious perspective. I am Christian, but I am not Catholic, and I'm not the Catholic that doesn't believe in birth control. So it's not any of that. It's more women are not accurately being told what these chemicals and hormones can do to their bodies and to their minds long term. And so to me, there is no informed consent happening around it. That's my biggest issue around hormonal birth control. From a philosophical point of view, again, to me, it's just transhumanism in a micro level of like we're shutting off our healthy bodies for the sake of industry. And this is where like people sometimes say, oh, you're such a conservative. Well, I dip pretty progressive when we get into capitalism and industry and all of that. I think we're doing terrible things to families and communities in the namesake of progress in industry and capitalism. So I can't really be placed in a box politically, but I think that birth control has only aided the devaluation of women and children and culture, and of our women's biology in particular overall. Surrogacy to me is the commodification of women's reproductive biology and the sale of children. And so from an ideological perspective, I don't think it's anything we should be messing around with at all. From the perspective of reality and having patients walked through it, currently walking through it, going to have patients again walking through it, I don't have any judgment in their particular pursuit of it. The desperation for a child is so intense, and that is in itself biologically driven, that I understand why people seek out that route if it's the only route that looks viable to them to carry a child. And I think if recently on X or Twitter, there was a lot of conversation around John Mulvaney and Olivia Munn, who just had a child via surrogate. And I can join the bandwagon on, oh my gosh, these two people in a hospital bed and it's all such a facade and they weren't a part of that. Where's the mother? I 100% feel all of those things, but I also feel Olivia Munn having cancer treatment, unable to have her own children, and desperation to be able to do so. I feel that part of it too. So, like the abortion topic, it's not a simple, easy thing that, oh, if we just do it this way, no one gets hurt emotionally or mentally. There is no answer where no one gets hurt emotionally or mentally. The way surrogacy is currently done and how much damage is done kind of depends on where you're at. So there's surrogacy tourism, where people from wealthy countries will seek out surrogates in poorer countries. And we had a huge issue when war between Russia and Ukraine first broke out. All these surrogates in Ukraine couldn't get out. They're in bomb shelters and things. And the parents of those babies couldn't get in to get their babies. And it's just a very clear picture of what's at stake with surrogacy when someone else is carrying your biological child, or maybe it's half their biological child and half your biological child. And then the reality of that child too, knowing one human for 9 to 10 months and then being ripped from that human and placed with two complete strangers, which if you could imagine, the only way I can as an adult visualize that is if I were ripped from Earth and placed on Mars tomorrow. Like I would have no concept of that, right? And so that's for that newborn being ripped from the only environment they've ever known, and the only attachments they've ever had. So all of those things are issues that aren't really even being addressed. It typically comes down to slogans around rights and bodily autonomy and all of those things, but it doesn't really address, again, the relational aspects of all of that.
I really appreciate the nuance that you pay to that you paint a picture that's really humanizing for people on all sides of that experience. And what is the difference between adoption and surrogacy from that standpoint, from that experience?
I'll do a little plug here. I did a podcast with the Equal Rights Institute around the difference between abortion, foster care, and adoption. And I would encourage people to watch it because adoption in and of itself is so confused with foster care that's a whole nother thing. But newborn adoption, just that, not to do with foster at all, and surrogacy. It depends on how it's done and what the difference is. So typically with newborn adoption, the adoptive parents aren't biologically related to the child at all. And that's typically true of embryo adoption as well. So there's no biological ties there. And that might be different from surrogacy, where the baby could be biologically just fathers, just mothers, or both of those, and a surrogate not be biologically related at all. So that's just one basic, like, scientific difference. Emotionally, I'm not sure that for the baby it's all that different. In both cases, it's a child being taken immediately at birth away from the only environment they've ever known and placed with a new environment. So I think it's probably pretty similar. And laws around both are very state dependent. So in my state of Indiana, with newborn adoption, parents have about 15 days to change their mind. But during those 15 days, they're separated from the baby. The baby's taken almost immediately, within hours, from the birth mother and placed with the other family. Where with surrogacy, there's not a whole lot of laws around surrogacy in Indiana at all, other than it can be monetized to such a degree that it's become a trafficking industry. It's still quite a financial investment to hire a surrogate, and they still are making money. The other law in Indiana is you had to have 2 live births before to be a surrogate. So I think their attempt there is to restrict women who have never had children of their own and don't know how that's going to go for them and what their own experience is going to be from doing it, because it is financially profitable. And also to protect the parents hiring the surrogate around, you don't know what their reproductive journey would be. But okay, so one major difference between adoption and surrogacy became very clear during COVID restrictions around vaccines, and like surrogates either wanting or not wanting to get the vaccine, and then the parents who hired the surrogate having a different opinion. That became a huge issue during COVID. And we see that same issue around abortion, where a surrogate may or may not want to terminate, and the people hiring the surrogate feel different around that in a pregnancy. And then what happens, and there's been court cases around who are the quote unquote owners of that baby should it not be terminated, or
Hmm.
can a surrogate be forced into an abortion? It's
Wow. So
all of this.
restrictions or impositions on the rights of the mother based on the desires of the surrogate, the intended family for the
Right.
baby.
And
Yeah.
vice versa. The surrogate could should desire an abortion and it not be biologically theirs. And what about the parents that hired them to carry their baby they're very now emotionally attached to?
Hmm. Wow, that's I would love to maybe have a longer conversation. I feel like I've asked you so many really for information or thoughts on so many really dense topics, and we've just had time to sort of scratch the surface on all of them. Just hormonal birth control alone, I feel like we could talk about for an hour.
Mm-hmm.
And just briefly circling back, I just want to acknowledge this, something you said in the beginning of this conversation about how when you were young and you were informed that you were likely infertile, that wasn't a big deal to you. It was just like, okay, well, information going forward. And then later on, it became such a big deal to you. And this really highlights one of the conversations that we're having so often around gender affirming care with kids who are really too young to understand what it's like to want to be a parent,
Mm-hmm.
making decisions that impact their fertility
Mm-hmm.
in a real and permanent way. So it's such a new, I guess, trend in medicine
Mm-hmm.
that I don't think we really know what that's going to be like in 10 years when a lot of these kids are hitting that age when they wish that they could become parents.
Yeah. And I don't treat gender dysphoria itself specifically, but I do work with people who are now infertile because of
Oh,
gender
you do?
care.
Wow.
Mhm. And um, it's devastating to 10 years after you've made a decision, realize that you can't undo what you've done. Um, and then that version of your life and future children of your own are unattainable to you. And then we enter into all these other discussions we've had around adoption, surrogacy. Um, we didn't discuss IVF or IUI, but those and all the
Hmm.
complexities around those, or embryo adoption. Like now you're opening the door to all of those very complicated situations that may not have had to be pursued had
Hmm.
this not happened. Um, and even I'm sure you're familiar with Prisha.
Hmm. The
Um,
detransitioner. Yeah.
yes, the detransitioner. So I've been very fortunate to get to know her personally.
Hmm.
And I've been very fortunate that we don't live very far from each other. And some of my local lady friends have donated milk that I've been able to take up to her
Hmm.
because after her baby, she was unable to breastfeed her baby
Hmm.
because her breasts were removed at 15. But even in that, she talks about they didn't get all of the breast tissue. And so she
Oh,
had milk come in and had no way to express and
oh
just
my
the
gosh.
pain and devastation and then potential
Yeah.
complications of sepsis and infection. And like, there's so many things we're doing to children that we have no ability to even ethically research. If you
Yeah.
can't ethically research it, why are we like doing it? I
Yeah.
don't, I can't even fathom even asking to do research on a child of like, we're going to assign you to the case that we take away your ability to reproduce and have orgasms and we're not you. And we can't ethically even do that. So why are we doing the surgeries?
Hmm. Well, it's amazing how strongly the thread of medical ethics runs through this entire conversation. You know, the entire fertile landscape, I guess. You've got chemicals that are being given to women that we don't really know what are doing to our bodies. We could talk about that again, that hormonal birth control piece. I'm just going to put a pin in it. And if you'd like to talk about that again,
Sure.
I'd love to talk with you about that because it's such an important issue. But then you mentioned IVF, IUI, which we didn't get to, but there's a whole bunch of stuff there. There's surrogacy, there's abortion, there's the sadism in medical care, the difference between treating someone with dignity and treating someone with control. And these gender surgeries where we really don't know what we're doing to young people's bodies. And they're being done. It's pretty incredible. What is going on with our medical system?
So when I boil it down to the smallest I can make it, to me, it's the difference between bodily autonomy and bodily integrity.
Okay.
And so, again, from an ideological, big picture, philosophical point of view, I would choose bodily integrity over bodily autonomy 100% of the time. Even realizing, like, well, Robin, they could tell you you're not allowed to pierce your ears because that would be violating your bodily integrity, putting holes where you don't have holes. Like if I had to give that up in order to protect the larger picture, then fine.
Mm.
Um, that's where I come down on it. But I know it's for a lot of people, it's not nearly that simple of a situation. So, yeah, to me, are we going to continue to pursue autonomy where we can do whatever we want to our bodies whenever we want to do it? And as a society, we're going to support that, not just in our laws or philosophically, but in our finances as well with taxpayer funds and all of that? Or are we going to try to do bodily integrity, or are we going to try to do a blend of both? And what does that look like?
I like that framing. It's going to give me a lot to think about.
Yeah, it's what percolates in my brain 24/7.
I'm so glad I got to talk to you, Robin. It's really
Thank
nice
you.
to have this time to chat about all these things that are in my mind too. And you're giving me new ways to conceptualize a lot of them. So I really appreciate it.
Well, thank you so much. I've been wanting to talk with you forever. So it's so nice to finally connect with you. I really appreciate it.
Where can people find you online? Do you have any recommendations or
Sure.
links you want to read out or
Yeah.
say out?
On it'll forever be Twitter to me, but X, I am at Truth Agape. On Facebook, I believe I'm under Robin Hughes Atkins. Hughes was my maiden name, and I just converted my page to a professional page earlier this year. So now anybody can friend, follow, whatever. I have a private one too that's separate. I have a website for my private practice. It's www.caris@veritasllc.com. I'm not sure if you'll have that in the show notes or whatever, because the spelling is, I wasn't thinking that through when I picked the name. I love the name. It means grace and truth, and I love the name, but the spelling of it's atrocious. But that website really does give a really good idea of all the types of things I see in my professional work day in and day out, as well as has information about the courses I offer for any practitioners that might be interested. It gives updates on when they're going to be available. We just finished beta testing, so when they'll be available publicly.
Awesome. Yes, I will put all those links in the description. So if people want to check them out, follow them and look at more of your work, that'd be great.
All right. I appreciate it. Thank you so
Yeah.
much.
Thank you, Robin.